This exercise is called hip abduction with hip internal rotation. What you're going to do for this exercise is lie on your side and stack your legs straight on top of each other and go into a slightly hip flex position, maybe 5 to 10 degrees. Your head should be resting on your arm, or you can come up onto your hand like so, or if this is more comfortable and you want to get on your forearm, that's fine too. But the important part is to stay vertical up and down here. I'm going to drop down and rest on my arm here and take my top side arm, place it here for stability, and I'm going to bring my front leg forward just a little bit. And then I'm going to internally rotate my hip, this top hip, which means point your toe towards the floor or your knee towards the floor, and then slowly lift that leg up, trying to maintain that proper plane going up and down. You want to go nice and slow, and you want to only go as high as you can go without yanking or pulling your pelvis towards your rib cage. So you want to maintain pelvic position and try and only move that leg. We're really trying to focus on these side abductor muscles right in here. A couple other things to think about when you're doing it is to make sure that you're not rolling back. That is using your back muscles instead of your hip muscles. And just really pay attention to your internal rotation, because you're going to want to, your body's going to want to turn back to neutral. This is a little bit more difficult in this position. So follow your instructions, do the repetitions that are recommended, and you should definitely feel a good burn right in here as you're doing your hip abduction with internal rotation.